I want to welcome everyone to the latest version of the VIA Live Product Training webinar series. And we're thrilled today to have the team from MTTS on to talk to you about some of their respiratory devices. Before we get to that, I wanted to just do a quick introduction to VIA Global Health for those of you that are new to working with us. So what we are is a medical equipment sourcing platform where you can source, quote, purchase and ship products from around the world directly to your door, any country. Our real focus is to make it fast, easy, and affordable for you to find the products you want. So it's all about creating awareness of those products and creating access for you to receive those products. So I'll take you just quickly through the website so you have a more familiar look as we're going through the webinar itself. So obviously, we start with the most used feature, which is our search bar. So you can search for any products from our thousands in our catalog. You can look at certain categories here, or you can shop all. You can look up a little bit more about us as a company, so you can build that trust in who we are. We also have buyer's guides, which I'll show you in a moment, which are a guide to help you understand how to purchase the products you're looking for. So a little bit more information to help you in your search. A little bit more information about where we are and what we do. So that actually that number is a little bit higher now because we had a few new countries come on in the last few days, but over 60 countries and over 1.5 million patients impacted in this work that we're doing. Some of our testimonials I can take you through, and then of course MTTS Impala is there that we're going to go through. So the first page I'll show you is the About Us page. So this is something you'll just be able to learn more about who VIA Global Health is, what we do, how we work, who our customers are, and generally what we do. So there's more to us than just a product catalog. There's everything from sales and support and customer service to logistics to market insights and product training, which is exactly what we're doing right now. So we try to always keep you informed and keep new services available to help you in your search because we know there's quite a few challenges. So that's the first page I'd like to show you. The second is our testimonials. So this is just customer feedback. So we can tell you how great we are, but we'd prefer to have our customers tell you the same thing because it's more important for our buyers to give you that support of who we are and what we've done. So from a standpoint of just our honesty and strong relationships, are helping our buyers to grow their businesses, obviously some pictures there to show that, and then reliable deliveries and positive impacts, because as much as we're about selling products and creating deliveries, we're all about creating impact to improve health outcomes in communities. So a little bit more here, if we go to our navigation on the site there, if you just click on that little hamburger icon. So there's a few things you can find here. Obviously the About Us page we went through. We have an FAQ, frequently asked questions. So if there's any questions you have about how we function, how our quoting process, how many years we've been in business, anything in particular, you can find that there. You can again find our testimonials here. Our latest news, so if there's any new announcements, like any new grants we have, or we've been featured in any publications, or we've reached a new milestone for patient impact lives, that's something that would be featured there. And then I'll take you just the product training. So obviously when we do these webinars, these are things that you can find the videos live, but you can also find the videos after the fact. So if there's any trainings we've done, you can find them all here for all the products we've done. This is a little bit more what I had mentioned about the buyer's guide. So you go to and then down there, COVID-19, newborn jaundice, quite a few, and we're adding more each day. So come back and check week by week to see which new ones we have. You can see here it's all about informing you about what the products do, how to find the key features, and make an informed decision for which product is best for you. So you can go through here, and again, you can look at things like ventilators, which we're going to go through one today, resuscitation devices, things like that. So again, it's all about creating services that help you find products and create access more easily. I'll just jump in now quickly to the shop page. So of course, you're here to find products and to get quotations and to make purchases. So the easiest thing that most people do on the homepage or throughout the site is the search. So you can search for Impala, and then you see obviously those products pop up. You can use more general terms, of course. You can search the word cannula or oxygen, and you'll get all those things. But of course, you have those recommendations, or you can just click that magnifying glass and it would bring up all the results. Some other things you can do is on this shop page, which has all of our products that would just continue to load as you go. That would be a bit overwhelming, of course, because we have quite a few products, over 1,000 products. So what you can do then is filter. So if you wanted to just look at things like respiratory and intensive care, you could click that and it would just drill those products down to what you're looking for. You'd see the ventilator there, the Impala. So that's the kind of search feature. But I want to talk to you quickly about the products we're going to go through today, and more just about how you find quick and easy information on these. We're very much about transparency and information sharing so that you can find everything you need to know about this product. So you can now see the images of the product in with the stand. So this is the version with the stand. We also sell this ventilator without the stand if you prefer. You can see any of the kind of short description here, quick bullets of important information of kind of where the product's coming from, what is the warranty term, regulatory approvals. We know those are very important for our buyers. Then you can go through the page. It's as organized as possible for descriptions, key features, specifications, standard accessories, but also optional accessories and add-ons. In some instances, those are links where you can go to the product page for those specific products as well. And then, of course, we know extremely important is those product documents, whether it's a manual, warranty policies, sometimes that might be a specification sheet, as well as regulatory certificates. And of course, we have videos. So once this webinar is finished and we finish the video, we'll also load that video onto the product page so you can come back and look at the Impala ventilator webinar if you missed it the last time. So a bit more here about FAQs, package contents, warranty. Again, it's all about giving you everything you need to know. So you're not waiting for us to get back to you. You're not wondering certain details. You can look specifically here about package contents and know exactly what's going to come in your package.
Yes, so today I would like to introduce you to the latest device, which we call Impala Ventilator. All our devices are named after certain animals, so I think MTTS as a brand is not as well known as the devices themselves, like Firefly, Dolphin, and now today we're going to talk about Impala. I would like to show the device as you can see on the picture and explain you how it's constructed. We have three elements. We have a stand assembly. This is the element number one. We have a breathing circuit all the way here, which I would like to talk more about, and the control unit that is in the center of the picture. The stamp assembly, it's when you receive that, it's packed in the flat box, and it requires certain steps to put together. Very easy, and we have instructions for that. It takes minutes. It's only 6 steps, 12 screws to put together, and it's all assembled. Obviously, it comes without the cylinder, the oxygen cylinder that you can see behind, the blue cylinder here, because we cannot transport them on long distances, plus they should be locally available. I would like to focus now on the very important part, which is breathing circuit. We provide, it's very important also to understand that we do provide breathing circuits with the device. There are many kinds of breathing circuits, and doctors often have their own preferences, so we made the device as flexible as possible for the use. So they can be connected to the single limb or dual limb breathing circuits. In this case, we have dual limb breathing circuit, which this is one of the options we offer. We also offer this entire breathing circuit is reusable, cleaned and disinfected, with the exception of this part, which is called HMEF filter, heat moisture exchange filter. This part unfortunately has to be disposed. It's not possible to clean because it's filter, not possible to autoclave or disinfect. The lungs here are optional. These are for testing. Obviously, this is just test lungs, and you don't use it for therapy, just here for the presentation. Very important feature of this patient circuit is the fact that it has 2 elements that determine the choices for the doctors for the setup. The flow meter this element is external, and in this case it's reusable, but they are also disposable ones. So flow meter, it's measured, the flow is measured here and transfer those two tubes to the unit for measurement. And the second important element is exhalation valve. In our case, this element is also external. Exhalation valves are often external, but there are a good number of devices that keep them internal, and there are pros and cons of each of these solutions. We selected the external for the flexibility and the fact that can be disinfected and reused, which internal ones have a higher possibility of contamination, especially when we talk about COVID patients, which the infection risks are quite high. We decided to go for this more flexible and simpler and also safer solution. So this is the device as a whole. I hope you can get more or less the idea how the patient suite works. And now I'd like to focus on the unit, control unit itself. So there are certain, the device is designed to be as simple in use as possible. There's a lot of work for us to do, a complex work to make sure that the device is easy to use. So when you turn it on, you can see the first selection screen. The first selection screen is about the gender, male or female, let's say which is female, and the height. And that determines a lot of presets later on. So let's say that female is 160 centimeters tall. We accept that. And we go into calibration, oxygen sensor calibration mode. It takes 90 seconds. 90 seconds for calibration, we can hear it. And once the calibration is done, I skip it because obviously we don't need to wait 90 seconds. Can be skipped. We go into the flow sensor calibration mode, which is also important. Flow sensor here, just as a reminder, is being calibrated. And now we can see on the screen that the calibration is taking place. Calibration, the skip is possible if the device is turned off by itself or for whatever reason, and you have to turn it on right away. That's why you have a skip function here as well. Calibration of oxygen sensor, calibration of flow sensor. I want to wait for that because it's one important step required. Now we're calibrating. And for that calibration, it's very important to flip that sensor for the second step in that calibration, which is described by the software as well, as you can see on the screen. Now we have to flip the sensor, calibration continues. I skip that because we don't need to watch that again. And the final step is I have to move back sensor to the original position. And the last step is something what's called occluding test. So we have to put our hand, block the outlet to make sure that the device perform the final calibration step. I failed that, I didn't occlude it, but it's okay. We can skip all those tests to go directly to operation mode. And now where we are in operating mode. I connected back the test lamps, which is off the screen, so we can see how the device works. So the device has many modes, as many ventilators have, and those modes are volume controlled and pressure controlled. So I don't want to go in each of the medical terms why they are here, but you have 8 modes, including CPAP and BiPAP, available for the doctors. So let's say we choose pressure controlled mode, accept that, and now we, as in the pressure controlled mode, we can choose certain parameters that are important for doctors and depend on clinical conditions of the patients. So this is the first one is respiratory rate. Let's say we choose 20 per minute. The next one is peak pressure. Let's say we choose 30. And the second one is PEP, PEEP. Let's say we choose 10. And flow, sorry, this is FiO2. So we can choose oxygen level. I leave it at 21. And volume, we cannot select in this mode because this is pressure control mode. And there is IE ratio as well here. So we choose this one. Then when we're ready, we just press standby button and the device starts operating. So I present the whole device again, the wider angle. Now you can see the lungs being used, and the device is set according to the parameters that we chose. So that basically as simple as it gets. There are additional functions. Obviously, you can go to the functions, how loud the device should be, so loudness, then the volume trigger ratios and beats per minute, set the alarms if you want. That's quite interesting. When they're gonna be activated, and calibration, you can perform calibration while the device is on. For more detailed information, it's plenty. This is diagnostics. So there's a diagnostic screen which will communicate in case something is happening as a serviceman or distributor. So the device for this is very easy to use. We spend a lot of hours to make sure this is not complex, because respiratory therapy can be complex, but familiar clinicians have no problem with adapting. They're familiar with the terms, familiar with the functions, and everything is very easy to use. For the preventive maintenance, I'm gonna shut down the device because it's quite making unnecessary noise. For the preventive maintenance, it's very simple. The unit itself has regular software updates provided by us if there is anything required. We communicate those by files, they can be sent by email, and just have to connect by USB. And the device itself, the circuits obviously can be, we also offer disposable circuits, so they can be disposed or can be reused. The reprocessing guides are available on the website, so you can access them and see detailed steps what need to be done. And the device itself can be disconnected from the stand, can be used as standalone, doesn't have to, can be placed somewhere else, basically like that, and you can just lift it up and disconnect. And behind there's a control panel where you have access to oxygen sensor and filter that can be changed should be changed every 6 months, because it has own air compressor. It don't provide air externally, you only need to provide the oxygen. So the air filter should be changed, and the oxygen sensor is rated for about 2 years, depending on the oxygen use. So this oxygen sensor has to change every 2 years. And batteries last for 4 hours, and the batteries always stay there. They can be charged by power source, AC power source. So there are 3 elements inside potentially be changed. Battery if necessary, almost never. Oxygen sensor every 2 years, let's say, and the filter every 6 months. And that is basically it. So it's very, very low maintenance device. And that's all. That's all I wanted to share with you today in Impala, and I'm now open to questions. If you have any, please go ahead and ask. I think it's going to be, I will try to answer everything you have.
For a lot of the questions that have come through about pricing and spare parts and quotations, one thing I will say is the purpose of the webinar is not to go through quotations. So if you do want to reach out for those types of questions, you can go to the product page, and again, I'll show you that again really quickly. So you can go to the product page and just request the pricing there and fill in your details, and someone from our sales team will come back to you. If you do have a specific question outside of just a quote, something about, what spare parts do you have, things like that, and you don't see it on the site, you can email us at sales@viaglobalhealth.com. And we can get back to you that way. But the easiest way to come to us is through the request pricing. A lot of questions have come through about the regulatory approvals, which again are here on the product page, so you can see that there, as well as warranty came through for both of the products, so you can see on both products that the warranty is included there as well. So I know there was a few questions just mentioning specifications and ventilation modes. Again, all here, I know Greg did mention it on the webinar itself as well, but we do try to give you all the answers to your questions here. It does take a little bit extra effort to go through the reading, but you can find that here. So as far as the questions that were not already answered in your thorough presentation, I think the first one with the Impala was just to talk a little bit more about the use of Impala with neonates, whether it's relation to tubing, humidification, flow sensors, or just generally the size of neonates and how that might function for a neonate versus an adult.
Yeah, so Impala as it is today, it can be used, theoretically it can be used with neonates. However, we need to take into consideration certain additional items we have to provide and different tubing size, as you can imagine. The model I was presenting to you, the size of the tubes and the HMEF filter humidity exchange is sufficient for adults only. This should be not enough for neonates, children, especially neonates. And neonates require additional humidification. And for that reason, we will need to equip Impala with additional humidifier as an external unit. We haven't done it yet. It is not difficult. It will be just additional part connected underneath, and the inspiratory tube will be run through that to the patient, and the gas should be heated. So the device should be also able to provide not only humidification, but also heat up the gas that has to be provided to the patient, the neonatal patient. So smaller size of the tubes, which are not a problem. Humidifier, which comes at additional cost as external unit, and a heater that has to be also additional power that has to be provided. We have that additional power in the device, so we could do it. As it is today, I don't recommend it for neonatal and pediatric patients, but with enough modifications, it can be done. For people who need it immediately, we offer Dolphin CPAP. This is for neonatal patients. Dolphin CPAP is equipped with heater and humidifier and blender, and this is perfect setup. However, it's only CPAP, so no ventilations, no mechanical ventilator, no volume or pressure assisted modes.
Okay, perfect. There was just another question about, you mentioned the alerts and alarms on the Impala. Can you just talk a little bit about what alerts and alarms are standard with this and what they would alert the staff about?
Yeah, so the typical alarms for when the set point is exceeded, is above, when we have the actual value above or below the set point. I think I can present you one. Oxygen is very easy to present, because if we don't connect oxygen and set it above 21%, then obviously we will not see that we've triggered the alarm. So I will turn it on and skip all the calibration steps. so we don't need to see it again. Now we have the device ready to be used, and I just turn it on. And now this is the typical alarm. Now you can see before the device start working, it takes seconds before it's gonna go. Now everything is under control. So every of this number that you can set, it will alarm if for whatever reason the device is detecting that we exceeding the set point or we are below the set point. And now let's say I set the oxygen to 50%, which we cannot provide because the oxygen is not connected. Then we're gonna have the alarm that external source of oxygen is something wrong with that, because we set it for 50, but actually we have only 21 at the moment, 21% of oxygen. And whereas number of alarms that is difficult to present, but they are related to the failure of the device itself. So I turned it off already, so you know more or less how the alarm is being communicated. And so we have the set point alarms, but also the alarms related to failure of the device. For example, power cut, blower, we have an internal blower, so if it's failure of the blower, there's no airflow, we alarm on this one. There are alarms, if power failure, well, it's not immediately because we have battery backup, so after 4 hours, you will see the power failure alarm. And finally, there are alarms related to the patient conditions. So we have the function detecting sleeping apnea, for example, there's no breathe, but it's similar way of alarming on the set points. So the set points in case of oxygen can be caused by the lack of supply of oxygen, but all the other alarms on the set points are triggered usually by the patient conditions. So, without going into many details, we alarm on certain patient conditions as well that clinicians are expected to be alarmed on.
Okay, excellent. There was just a follow-up question on the previous one where you had talked about the different humidification or humidifier and neonatal tubing. Is that available now, or is that something that'll be available in the future? And if so, when do you expect that?
It is not available now. It can be available. We didn't have intention to develop it, but with enough feedback from the customers, we can develop it relatively quickly because it's all related to external components. Right now, I would say we don't have plans to do it, but if there is a customer asking for that, or enough customers asking for that, we can do it within probably maximum 2 months. It's all about sourcing external components and integrating them to the stand underneath. Instead of the basket, we're gonna have humidifier tubes. We source externally already from the same supplier. We're gonna have different size of tubes, and so humidifier together with the heater. We already have that for adult and CPAP, so we're ready for that, but we don't offer that right now.
Okay, perfect. Quick question about oxygen sources. Is there any limitation to oxygen sources? Can that be wall oxygen, cylinders, and concentrators, or are there some that are not okay?
All sources are okay. We are actually this is one of our differentiators against similar price point devices. They are limited by the input pressure. We have the oxygen port here, standard VSS oxygen port that accepts up to 60 psi's, and that means it can be used in wall oxygen and the cylinder, while many devices that are offered at this price points are only accepting up to 20 psi's, which means they can work only with oxygen concentrators, which are much smaller pressure devices. Ours is accepting up to 60 psi's, which means oxygen concentrators are fine with them as well. So all sorts of oxygen sources up to 60 psi's, basically means in medical ward everything. However, I just want to mention that thing because this sometimes misunderstood, or people think that oxygen concentrator solve a problem entirely. Any ventilator, including Impala, used with oxygen concentrator will be limited by the oxygen concentrator maximum flow and maximum oxygenation level. So if the oxygen concentrator can produce, say, 10 liters per minute of 95% oxygen, which is already great. This is the best in the market. Usually it's half of those. So usually it's 5 liters per minute, 90% of oxygen. Then Impala obviously is going to receive that oxygen with that flow, and the performance of Impala, it's going to be limited by the maximum flow produced by oxygen concentrator. So if the adult, especially adult patients, for neonates, pediatric, I think we are okay. But if we think about adults, those limitations can be not good enough to provide the appropriate clinical treatment because they may need much higher flows. For adults, we're talking about flows in the range of 20 liters per minute, maybe higher, obviously blended with air, so we may be okay, but oxygen levels also. So certain patients will not be oxygen concentrators will be a big limitation for certain patients. So I want to make sure that people understand that a limitation. It's not the connection, it's not the Impala, but it's going to be the source of oxygen that may be not sufficient.
Perfect. Well, Greg, I really appreciate your time. I know it's not a bad time for you, but for some folks on the line, it's very early or very late. So I want to thank everyone for your time and joining us for the latest VIA Live product training series. And Greg, thank you for your time, and everyone joining, thank you for your questions, and we look forward to seeing you next time.